Thank you, everyone, for being here today. Welcome once again. Hi, Christine. Got your camera on? Good. Welcome to the Peoria City County Health Department. It's Wednesday, May 6, 2020. I'm here on behalf of Mayor Artis, Chairman Zimmerman from Tazewell, and Chairman Krug from Woodford. I'm Andrew Rand, Chairman of the Peoria County Board, not the Peoria County Health Department. Made that mistake the other day. The weather's good. All systems are still go here in central Illinois. There are a lot of conversation in the community about the level of contagion that's apparent. A lot more testing has been taking place since we started this journey almost 2 months ago, I guess. Monica Hendrickson is up next to report on those many data points. I want to thank everyone who has been working hard to collaborate with the health department and our community healthcare leaders at both hospital systems and all of the medical care providers and first responders who are caring for us each and every day at quite some risk and peril to themselves, and all the other first responders in non-healthcare functions who are making sure we eat and our cars work and our air conditioners cool us. A lot of discussion from yesterday about a governor's plan, a lot of discussion perhaps about the evolution of a local plan. We're not really ready to talk much more about that today as those details continue to be refined and these discussions and negotiations continue to occur. But I am telling you, Ms. Hendrickson is prepared to discuss everything she's able to, and she's up next. So thank you, and welcome to the press conference. Director.
Thank you, Chairman Rand. Today marks the first day of National Nurses Week. Actually, it's kicking off with National Nurses Day, and so just to kind of do a shout out to all the nurses that are working not only specifically for COVID response, but of the hard work they do day in, day out. And I would just like to actually take the opportunity to acknowledge the nurses that the health department has. Tracy, Rebecca, Monica, Katie, Brenda, we really appreciate all the hard work that you do day in and day out. And so just wanted to kind of bring that up front as well. Our to-date totals for the Tri-County region is 195 confirmed cases. That includes 128 cases in Peoria County, 52 in Tazewell County, and 15 in Woodford County. We want to make some clarifications in regards to the to-date totals for death. Peoria County is reporting 2 new deaths to bring it 5. Tazewell County is reporting 3, which is 1 less than yesterday. There was an error in the electronic medical records that indicated the wrong location and had an older address, but after investigation, it is actually attributed to the Peoria County. So that is why Peoria County is sitting at 5. Tazewell returns to 3, and Woodford is at 1. So the total for the area is 9. The 2 deaths in Peoria County, again, one is a woman in her 90s that resided at Generations in Peoria, and the other is a male in his 50s who also resided in Generations in Peoria. Both of whom, and working with that long-term care facility, they have been working diligently in these cases. They are unique, and these individuals had multiple comorbidities. And so, again, just wanting to acknowledge the loss of lives related to COVID in our community. Overall, 60% of the Tri-County cases have recovered. 26% of the Tri-County cases are at home and isolating, and 9% of the Tri-County cases are hospitalized. Again, repeating, that's 60% of cases are recovered, 26% are at home isolating, and 9 are hospitalized. Specifically in Peoria, 71 are recovered, 38 are at home, and 14 are hospitalized. In terms of our hospital systems, OSF St. Francis Medical Center, Unity Point Health, Methodist, Proctor & Pekin, there are 15 ICU beds currently in use for COVID-related, 3 for persons under investigation, and 12 for confirmed cases. 32 beds or non-ICU beds are currently being used for COVID-like illness, and they're reporting 1 new death. Again, that would be the Peoria County resident I mentioned earlier. As of 3 p.m. today, Heartland Health Services conducted an additional 137 testing between the East Bluff and the Carver sites. I believe tomorrow they will be addressing some updates in terms of how they're doing testing and some kind of follow-up information that they have available at the tomorrow's briefing. With that, I know there are a lot of questions coming in terms of what happened yesterday, but one of the things I think we can always understand is the fact that a lot of our community partners are looking at this ability to maintain this public safety as well as their health by still offering services. And one of those community partners is the Peoria Public Library. So I'd like to introduce Randall Yelverton, who is the Executive Director for Peoria Public Library.
Thank you, Monica. My name is Randall Yelverton. I'm the Executive Director of the Peoria Public Library. I wanted to come and share with you our information about our new limited curbside pickup plan for library patrons, which started today. First, I want to thank the County Health Department, Mayor Artis, and the City of Peoria for supporting Peoria Public Library's plan to offer curbside service. Today was our first day of curbside service, and we were very busy answering calls and filling patron orders. In fact, I understand that at least a dozen calls came into our North Branch in the first 5 minutes of opening the phone lines. Our loyal patrons are thrilled to be able to pick up items from the library again, and we are glad to have developed a protocol that allows us to safely offer them items from our extensive collections once again. The Governor's new order allows us to offer limited service to our patrons, and we have developed a safe method for delivery of library items to them. We have made the safety of our patrons and staff the highest concern throughout the pandemic, and we will continue to make this a priority with our curbside service. Library patrons can call our main, Lakeview, and North branches and place holds for library items. We also have a dedicated number for anyone needing to place a hold in Spanish. Patrons can also place holds through our online catalog, which you can access through the library's website at peoriapubliclibrary.org. Once we have retrieved those items, we will call the patron back and give them time to come pick up their items. When they arrive at the library, they will park in a designated space and call to let us know they have arrived. Our staff, who are wearing masks, will then come out to the patron's car and deliver the items to either the patron's trunk or through their open rear passenger window. We are asking all patrons to continue to return items to the library's book drops and not to hand these items to us. Throughout the pandemic, we have been exercising significant caution with returned items. Staff have been putting on gloves when they empty the book drops and have been letting the items sit for at least 72 hours before checking them in. We will continue to follow this same procedure. We are also working with a limited number of library staff in our buildings in order to maintain safe social distance. For those patrons who can't come to the library or do not want to pick up items from the library, we continue to offer an extensive and robust digital collection. We have over 1 million digital items available, including ebooks, audiobooks, music, movies, and TV shows. We also have great reliable information resources that are online that you can access through our library's webpage. These digital resources have allowed us to continue to offer library services even though our doors have been closed. We're pleased to say that usage of our digital services has increased over 45% recently. And even though e-learning may be winding down as we get closer to the end of the school year, I'd like to encourage families to check out our databases for help with online learning. BrainFuse, for instance, offers live online tutoring for students in many subjects. Also, our library staff has been hard at work during the shutdown creating digital programming and new online content for our patrons. I have been meeting with our management team daily, developing plans for library services, including how to offer curbside service safely. Patrons who do not have library cards can apply for them through our website. If you have questions about how to use the library, you can contact us via our website as well. We've had tremendous success in our first day of curbside service and have found many eager patrons ready to access the quality collections and services that they've come to expect from Peoria Public Library. I spoke to a woman today on the phone who told me her son cried when he first heard that libraries had to close and that they were thrilled to be able to check out some items once again. Thanks to an ongoing cooperative agreement with libraries surrounding Peoria, patrons from surrounding communities who have been able to visit our libraries in the past and check out items are invited to continue to do so. We welcome them to take advantage of these curbside services. If you have questions about whether or not you can check out items from Peoria Public Library, You can call our main Lakeview and North libraries from 9 to 11 a.m. on Monday, Wednesday, and Friday, or contact our library staff with your questions through our website. Thank you again to the Health Department and the City of Peoria for your support of our curbside plan, and to library patrons throughout the area who support our libraries. We appreciate you and look forward to seeing you again.
Are there any questions for the library? Thank you. Then I will open it up for questions.
So I guess first, Monica, correct me if I'm wrong, seems like one of the largest daily increases that we've had in this area, especially for Peoria. If you could just speak on that for a moment.
So the question is regards to the increase we saw today for Peoria specifically. Looking back, we recognize that a lot of this had to do with delay in reporting. Again, the state is wanting our labs to utilize electronic laboratory records, or ELR, and oftentimes we've put a lot of capacity into gearing up the ability to start testing, and oftentimes the ability to then start reporting electronically is the next phase of it. And so with the influx of these, there was a technical issue, and so we would have had maybe 5 cases yesterday and then the remainder today, but they all came in today.
Yesterday you said it was more than 90% of cases or people who have recovered in the Tri-County area, and today is 60%. Did you say 90% yesterday?
No, I did not. I was actually had addressed that with our PIOs. It was always in the 60s.
So yesterday was, do you have the exact percentage?
No, but we can get that after the briefing.
Okay.
The woman in her 90s, she was the lady that you talked about yesterday from Generations Riverview, right? The 2 deaths, she's actually in Peoria County?
Yes, so again, to clarify, the woman in her 90s that was attributed to Tazewell County yesterday, based on further investigation through the Tazewell County Health Department, it was an error in the electronic or a non-updated electronic medical record and had the wrong address. It is actually the Generations of Peoria.
Of Peoria, and you said yesterday she lived in Riverview, which is the East Peoria.
Exactly. So it was, they had Generations correctly, but it is the Peoria one, not the East Peoria one.
So there's only actually one new death today?
Correct. There's only one new death today.
Okay. But both in the same facility?
Yes.
Do we know how many positive cases are at that facility?
Again, when we look at long-term care facilities, we've always, and there's going to be an argument that's maybe a little bit unfair to them, but we've always overly been cautious with them. So it's not just a confirmed laboratory test that we actually count. We also include any suspect cases. And so Generations of Peoria has been working with our health department for multiple weeks now, addressing a lot of the issues that we see. And again, I want to preface that both these individuals had high-risk comorbidities. The long-term care facility has been doing everything in terms of what has been asked for them and going above and beyond in certain issues as well. And one of the individuals was also very much a close contact of one of our original cases. And so we did expect some of these cases to kind of progress down this line. But again, the reporting is all available in the Illinois Department of Public Health. But remember that those data points include also suspect cases.
Do we have any update on the timing of what we spoke about last week in terms of testing coming into these facilities where the people that work there would be giving them to the residents?
So the question is regarding the testing that we would like to see at long-term care facilities. My understanding is the Illinois Department of Public Health is reviewing the strike teams, as they're terming them, to making sure that some of the best practices as well as any issues that they've learned along the way are addressed moving forward. Again, we would know locally here when a strike team was in our community through the Illinois Department of Public Health regional office. We've yet to be informed. So one of the things that we've done is actually sought out supplies to begin that process. I believe the long-term care facilities have been in contact with our coordinator here locally to get the education portion started, and that we are now just waiting for the test supplies that we requested. Again, we requested 1,000 test supplies. Whether or not that comes to us here locally, that's going to be the issue. But we are still stressing that all long-term care facility staff, if able to utilize those community-based testing services through Heartland Health Services.
So, Brian Spain held a press conference today. Now that we've all had a little bit more time to look at the governor's Restore Illinois plan, maybe you have a little bit more information. But Ryan Spain said that according to the metrics that would be required to go to phase 3 here locally in our area, we've already been at those metrics as outlined for a month now. So would you say that's an accurate picture of where we're at?
So I think in the question is in terms of the metrics that have been put forward to Restore Illinois, where do we sit here locally? And there are really a few metrics that are utilized. One is ICU capacity, the surge capacity. The other one is positivity rates as well. And if you were to go back, we have been sitting well below that requirement that the Illinois Department of Public Health and the governor's plan kind of outlined. But also recognize that we, a month ago, also were in a different phase than we are today. So with every intervention change, with every step phase, we do want to reassess and kind of monitor. But Representative Spain is correct. You know, here regionally in Peoria, we have been really well aligned with what those measures are. It's now, as we transition, knowing that there's been some relaxations of policy, but also we've seen other communities maybe decide not to necessarily comply at the same level they did earlier, again, wanting to continue monitoring it. But I think Representative Spain makes an excellent point, which is some of this data we'd like to, as locals, be able to have easily accessible across the board, not just here in Peoria, but I think in all of our neighboring communities.
So let me ask, if we've already been at this point for a month, let's say we get to May 29th, we're still in a good place. So at that point, we've been in a good place for almost 2 months now.
Mm-hmm.
So is there an argument, I mean, keeping in mind that as of right now, we are in this big north central region, includes Rockford and the Quad Cities and Galesburg and all sorts of other communities, but do we make the argument that we could move from phase 2 to phase 4 per se if the data supports it?
The question is, can we, if we sit well in the metrics, can we move or even bypass a phase? And I would be very hesitant on that because the phases are meant to allow two things to happen. One, to allow for your public health system to gear up even further for contact tracing, your healthcare capacity to be also able to monitor and also necessarily gear up, and then allow your economies to reopen as well. So if you bypass something or you try to speed ahead and your other two partners are not in the same boat as you, you have the ability to outpace them. And really this is going to be kind of a partnership that you want to all go through together. Having said that, I do think that the Illinois Department of Public Health is interested in understanding, is there a gradient approach in terms of these phases? And I think what Chairman Rand mentioned, as well as Mayor Ardis, about Peoria's kind of understanding of this is there ability to progressively go through these phases in a way that makes sure all three are at the same pace?
So since we are, as of right now, and for the foreseeable future, grouped with all these other counties across the northwest portion of the state, essentially, I mean, what's that mean for you as a health department in terms of talking to some of the hot spots around the state, like Warren County, where the Smithfield plant is, in Monmouth has had a lot of cases, up in Jocelyn, Rock Island, there's been a lot of cases, Rockford, of course. I mean, is there wider coordination in talks to say, hey, these are hot spots, how can we help you out, since we're all now a region?
So the question is, with the region that we're in, being very large, how is there coordination or the ability to partner? Local health departments have been working together prior to COVID. I mean, whether it's understanding rules and regulations, how you interpret, how your enforcements, there's always been a very strong communication by local health departments. But I think the important thing to understand is that by state statute, local health department authority falls within their jurisdictional lines. And so there is still that recognition that, I think every type of, public service that we have, the sheriff's department, school districts, they work with a multiple regional approach all the time, but the jurisdiction is still within their boundaries of their county. And so I think there's a balancing act here, which is we're recognizing that we're doing a regional approach, but at the same time recognizing that each local health department is still very much a local health department. And so we've always shared resources and we'll continue to do that. But I think what's going to be really important moving forward is if you haven't visited the Illinois Department of Public Health website, and there is also a link at the Peoria City County Health Department website, is that there is a daily update in terms of the metrics. I think it's called Restore Metrics. And so for the North Central region, which would be the region that we're in, we currently are sitting at a 10% positivity value. If you were to separate the two regions, there's two actual EMS regions in that area. One is at 13, and the one that we sit in is at 8% currently. And so I think there is something to be said that while we do recognize that these hot zones, as an overall region, we also see that we also kind of correct it as a larger swath of land. So I'm not necessarily worried about hot zones popping up and saying that, oh, that's going to lead us to slow down. It's actually the inverse, where if you're a community that has a hot zone, does your numbers get diluted because you're in such a larger capacity? I think that for me is more of a rationale for why maybe these districts are too large, because you could not necessarily say that one district is holding us back, but at the same time, one district might see that they need to be on pause, that something's going on, and it gets diluted in the numbers. And so I think, the argument can be made actually for both ways, that it might be take a look to see if these regions have any capacity for being focused down further.
Going off of that,
Just talking about resource sharing then, so to go into that, let's say that there is an area of Winnebago County where Rockford is, that is a hot spot, and we know, so here, you said 132 test use at the two Heartland sites, that 300 available. We've been using less than our total allocation every day for a while now. Could we theoretically say, let's share these resources, help you out, send some tests your way, since we're not using all of these?
So the question being, if you have a surplus of resources, your ability to share, and specifically thinking about testing. Now, I think tomorrow's press conference with Heartland Health Services will answer some of those questions because they're specifically attached to a federally qualified health center. But overall, resources including personal protective equipment, human capacity as well. We've done that type of sharing routinely during this event. If you see a hot zone happen, we do what's known as called an IFMIS request. It's actually a mutual aid system for local health departments to say, hey, I need some nurses or I need some investigators to help me. I've kind of got a larger outbreak. Can you assist? And so that does happen routinely, and I think that's going to continue regardless of if it's COVID or something else. But I do think it's important to understand that when you're looking at that plan, there's going to be a larger need for communication at a variety of levels, especially recognizing that how many, not only just health departments are in this area, but how many hospital systems are also going to be a part of this conversation.
so then kind of going back, so you mentioned obviously capacity is what kind of becomes a really important issue. I know you gave specifics about what our positivity rate is here. Do you have that number about ICU capacity? And then, as you've mentioned before, talk about how specifically for our area that's important because we have such a major hospital system.
So that's a great question. The question is about the ICU capacity. I don't have it broken down for both hospital systems, and as part of the Restore metrics, they do talk about surge capacity. So right now, for our north central region, the average ICU availability sits at 43%, as well as the available vents available is at 78%. And so we are sitting in a really good point in time in terms of our healthcare capacity. But again, it's something we want to monitor because deferred surgeries or deferred procedures are now coming back online. And so that can change the model of the healthcare system as a whole as well. So I appreciate what I think everyone's trying to do is how do you restore Illinois to a point within a public health parameters and being mindful of that. And the biggest thing to do is going to be that we're going to take this, I think, as together, hopefully, and very much in a phased approach and monitoring it the whole way.
When we look at those phases, it's been talked a lot about on the state and national level. Do we know in terms of locally how soon or potentially we could see some of those, instant tests that are talked about?
So the question is about the instant test or the rapid test. I think when more testing gets vetted and gone through the FDA process, having those available is going to be key because part of this understanding of COVID is our largest tool we have in this is to detect early, quickly, and then be able to investigate and contact fast. That's going to be how we can, quote unquote, reopen and restore in a faster capacity. And so really, any type of movement in that is going to be beneficial for our area. We haven't seen it here to the level that we'd like. We know that there's still a vetting process that's going on. But the good news is, I think our testing capacity, and you'd mentioned it earlier, which is the fact that we've only done 137 tests today from Heartland Health Services. So I really would employ people to utilize a Heartland Health Service testing capacity. If you think, oh, there's a line, or maybe I shouldn't, really, take advantage of it. It's a great resource we have here. It's not just for Peoria County only. Woodford, Tazewell, our neighboring communities, Fulton, Knox, you can also come here and utilize that service as well. It doesn't have to be just for Heartland Health Service patients.
How long do you think that will be available to the public? As people continue to get tested more and more, the amount of people who get tested may decrease. How long is drive-through testing going to be available? Just as long as we need it?
So the question is how long drive-through or community-based testing will be available. Well, I want to make one point very clear, which is that testing is always going to be a point-in-time test. So even if you test today and you're negative, it does not mean that you are negative tomorrow or 2 days from now. It just means that you were negative the day that you took that test. So it's not that we're going to have a bulk of negatives that happen that now means that we don't have it in our community anymore. On the flip side of it, part of the governor's Restore Illinois plan is making sure that when we reach further along in our phases, that community testing is readily and widely available. So I don't see our community testing shutting down. They may change locations, they may change capacity, but I think to go along with what the governor proposed, they're looking to making sure that community-based testing is very much continuous in this process.
Monica, there was a plan sent to the governor from Mayor Artis, and you guys also collaborated about steps on how Peoria could open maybe a little bit earlier. But then Governor Pritzker also rolled out his own plan that same day that we learned about it. Were there similarities in both of your guys' plans?
So the question is between the plan that came from Peoria County and the city of Peoria, as well as the governor's plan, that comparison. And I think overall, yes, both were a public health approach that had metrics. I would maybe argue that we were a little bit stricter in our metrics here locally, but that's also because we recognize that our largest employer and one of our anchoring institutions are our healthcare facilities as well. And so I think we had very similar approaches because at the end of the day, I think both plans were really built on the understanding that it has to be a phased approach, understanding that what you're trying to do is in a gradual or kind of very specific way, look at how contact tracing and the intensity of contacts really dictates virus spread. And so making sure that you're going through a process that kind of adheres to that. But really a lot of the metrics were similar, and the ideas behind it was, I don't think any plan said that we were going to have a large-scale activity tomorrow. I mean, I think we all recognize that those type of events, which have a lot of contacts and intensity of contacts, are going to be ones that, as the governor said, later down the road we have to, maybe reassess, but definitely not tomorrow.
Monica, on the nursing home testing, you said that you had requested 1,000 tests from whom?
From the Illinois Department of Public Health.
Okay, and when do you expect to get those?
We ordered them last week, and so again, I think this is along with any type of supply chain issues that we have. We hope to get it as soon as possible, but we recognize the fact that testing kits are going to, we want to make sure they're being utilized correctly. We may not get all 1,000, but again, we hope to get them hopefully this week or next.
Okay, and then has training started?
I believe they're coordinating training right now, making sure that everything's been standardized, and then identifying in the nursing homes key staff to be trained.
When you say train, that means training on how to administer the test?
So the training as part of the nursing home program is to administer the test, as well as recognizing the processes. There's also paperwork and kind of proper processes to make sure there's not cross-contamination. So lots of things that our nurses and our healthcare staff do day in and day out, but is really making sure that if they're not familiar, haven't done the procedure in a while, as well as all the parts that go into it when you're submitting it to a state lab.
As we get more tests, do you think that more
Will all our area nursing homes have staff that will be capable of doing these kinds of tests?
So the question is, do all of our nursing homes in our area have staff that's capable? I think it's really understanding the definition of nursing homes. When we talk about nursing homes, we talk about a very large group of entities. Some of them are critical care, very intensive care nursing homes. Others are more relaxed, so to speak, like senior living. And so we have asked all of them to assess where, if they have nursing capacity or medical capacity, and if not, how we can support them. We are looking at some of our community partners to step in and provide that supporting if they don't have that. Because again, we call nursing home kind of in a colloquial sense, but it covers a lot of different gradients of care.
Do they have to be RNs to do this kind of test?
So the question is, do they have to be RNs to do this type of test? No, they do not.
As we get more tests and time goes on, do you see other entities being able to give out COVID-19 tests? Like, for instance, the flu, of course, has been around for a while, but you could even go into like your local Walgreens and get a flu shot or anything like that. Is there anything that you think other pharmacies may be able to offer these tests at some point this year?
So the question is, as we progress through this response, even as a nation, do we think that we will see COVID testing pop up in different locations? I wouldn't be surprised if that's made available, but again, as that really is long-term planning. And right now is making sure that we get testing through to those key entities. First it was our hospital systems, then moving on into our long-term care and into our FQHCs, or federally qualified health centers. So it's really going to be a staggered approach. But I expect that COVID-19, like other things, will become part of our new norm as we move forward. And so if that means that we're going to get testing in through pharmacy points or in other locations, that wouldn't surprise me. With that, thank you, everyone. I will not see you tomorrow. That is my mental health day, and so I will see you guys on Friday.